Week 34 of pregnancy. Welcome to the home stretch. At this stage, your baby is about the size of a butternut squash, weighing around 4.7 pounds and measuring about 17.7 inches long. It's incredible how much your little one has grown, right? Now, let's talk about what you can expect during this exciting time. Your baby's lungs are continuing to mature, and they are practicing breathing movements by inhaling and exhaling amniotic fluid. How amazing is that? Their skin is also becoming smoother as they pack on more fat, getting ready for life outside the womb. As for you, mama, you might be feeling a bit more uncomfortable as your belly continues to expand. Backaches and pelvic pressure are common at this stage, so make sure to rest when you can and practice good posture. Remember, it's all part of the journey to meeting your little one. You might also notice an increase in Braxton Hicks contractions, which are like practice contractions that help your body prepare for labor. If you experience regular contractions that are getting stronger and closer together, it could be a sign that labor is approaching, so keep an eye out for any changes. It's essential to stay hydrated, eat well, and continue with your prenatal appointments. Your healthcare provider will monitor your baby's growth and make sure everything is progressing as it should. If you have any concerns or questions, don't hesitate to reach out to them. They are there to support you every step of the way. In these final weeks, take some time to relax, practice deep breathing exercises, and bond with your partner and baby. Soon enough, you'll be holding your little one in your arms, and all the discomforts of pregnancy will be a distant memory. So, embrace this magical time, mama, and know that you're doing an incredible job growing and nurturing your baby. Week 34 is full of anticipation and excitement as you prepare for the beautiful journey of motherhood. Enjoy every moment, and before you know it, you'll be welcoming your precious bundle of joy into the world.